Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. Welcome to another episode of Let's Talk Small Data with T, where we explore the power of small data in healthcare. And it's Women's History Month. In today's episode, I dedicate to all the beautiful women and girls out there. I'm so honored to have Dr. Keosha Bond joining us from Manhattan, New York. Dr. Bond and I met on a recent National Coalition of 100 Black Women webinar, and I was blown away by her presentation on sexual health equity and Black women. And I just had to have her on the show and talk to her about some of the data that she was presenting. And I'm just really excited to talk to her about this whole issue of sexual health equity. I'm really excited to learn more about it. And I want to present that to you, especially for Women's History Month. Dr. Bond is a public health professor and sexual health researcher who has centered her work on the complex intersections of race, gender, sexuality, and racial equity among marginalized populations. Dr. Bond, welcome to the show. And I'm going to present you as a panelist so that we can see your beautiful face. And I can see that there you are, you're unmuted.
Here I am.
Welcome. Welcome. Thank
Thank
you
you.
so much for joining me today.
Thank you for having me. I really appreciate this invite, and I love being able to talk to new people, more people about this issue, just to bring more awareness about sexual health.
Totally, totally. I'm so excited to hear more about that. And I guess that's a good place for us to start when we say sexual health equity. What exactly do we mean by that?
Well, when you think about sexual health, the first thing you should really focus on is what sexual health means.
Mm.
And it's not just the state of the physical aspect of sex. And that's what usually many people just focus on. But it's also inclusive of like the emotional and mental and the social well-being related to sexuality. So, and with that, you realize that it's not just the absence of disease, really, or the dysfunction of it. So it's beyond the idea of that we're just preventing STIs in relation to sexual health. And then when you look at health equity, what that does is it means that we are trying to get to a point where people and communities have the opportunity to fulfill the potential and the highest level of health. So with those two things combined about what sexual health really means and what health equity means, combined, it's really getting to the point of what is the highest level of physical, emotional, and mental and social well-being related to sexuality for an individual. So that's how I would classify sexual health equity, is getting to that point and looking at what kind of services we can look at and the type of education that we're providing to people, and increasing literacy as related to health. So it's just so many things in that area.
Seems like promoting or encouraging better access to stuff that folks need in order to really ensure proper equity has a lot
Yeah,
to do with what you're pushing and promoting, right?
yeah. And not just promoting more access, but really understanding that there's not a one size fit all for people.
Right.
We really need to take a intersectional approach to it and understanding the multiple identities that people have. There's multiple like social identities, and and move away from this stigmatizing view that it's only one way to have sex or to be sexual in our
Right.
society, because with that we create more stigma, more discrimination, and we hinder people from even accessing the type of healthcare that would really benefit them.
Okay. Interesting. Interesting. Yeah, there's a lot of talk about, I have this word in my head, equity. I'm just constantly hearing about it, like even vaccine equity. So I was just listening to a talk of Governor Cuomo and Hazel Dukes of NAACP, and they're talking about the National Urban League coming back to Harlem and providing more access. It's more in line, it's in line with this providing equity
Mhm.
and really paying attention to the issues and meeting people where they are. Um, so
Yes.
yeah, you presented some great statistics and a lot of, I'm a small data person, right? The whole podcast is about how are we using small data to really highlight and identify where the issues are and where do we need to focus when it comes to sexual health equity. Where do you turn to for your data? And I guess a lot of that data that you presented during the National Coalition meeting.
So usually when to get the epidemiology of I would say of the health issue that I'm looking at, I do usually turn to our national statistics and looking at like from what's provided from the CDC as it relates to HIV and sexual health,
Mhm.
but also on a more deeper level, I would say, and I always talk about this when I speak to my students. I am a mixed method qualitative researcher, and I feel that the data, the numbers are very important, but
Mhm.
they only tell part of the story. And so most of the time, especially with the stigma that has been associated with HIV, we have the tendency to look at those numbers and we associate it with something negative, something bad that's happening. And what's bad is that there is a disproportionate rate of individuals who are vulnerable to certain diseases. That's the negative side, but it doesn't mean that these are bad people. And so
Right.
much time in our in health, when we look at the numbers, we only see part of the story and we interpret it that way still. So I
Right.
like to include like qualitative data along with the numbers to kind of round out and tell the full story of the individual, really. Because sometimes I think the numbers kind of overshadow
Mhm.
what's going on, really. And
No,
so I
totally.
like to use both. I feel like they complement each other. They're best friends in that
Yeah,
way.
no, totally. I understand that. So like the whole concept of small data, it's like, we look at the big data, we're zeroing in on the small data, but once you have the data and the data is supposed to be there to help you take action. Now that you know where you need to focus and with who, and where they are, now you collect more information so that you can see the full story and like really take some action to make some improvements. Um,
Absolutely.
yeah, and with sexual health equity, what do you think is a key issue um, with this that we really need to focus on right now as it relates to Black women? And I threw girls in there because the girls become women.
I know.
Now, where do we need to focus, and where do providers and folks need to step up to the plate, so to speak, and pay attention and take some action?
Like, how long do we have today?
I know. I know. We can always have a part two, three, and
I
four.
know.
I
There's
mean,
so
I would
many
love,
different.
yeah, no, totally. And I would love to have you come back actually. And before we get off the topic, I just interviewed a couple of folks. Burgess Harrison is the executive director of the National Minority Healthcare Association, and they're doing some fun things and very powerful things to help close the minority gap.
Mm.
And this population is part of that. So I would love to have all of you on the show, and we could just have a nice chat about equity and healthcare equity, and we can go crazy. But just to get back on topic, sorry to interrupt you. Go ahead. You were getting ready to jump in.
No problem.
Where do we need to focus? Yeah.
So I'll start with the level of most of my training, which is health education.
Okay.
And so I feel like one of the biggest disparities we have in issues with healthcare, especially sexual health, is that we don't provide comprehensive sex education that's inclusive to
Hmm.
all individuals, to all young people.
Yeah.
And the thing that there's no real standardization now still in 2021 in our school systems of what type of education we should be providing, and the
Mhm.
fact that what was allowed because of funding was abstinence only doesn't tell the full story
Mhm.
at all. And it is not saying when you provide comprehensive education that's inclusive that you are not talking about abstinence. It's just that you're explaining and being fully given a full picture of sexual health
Mhm.
and what that may mean for an individual, And so I think that at the basic level,
Mhm.
and I say that clearly, like it's a basic level to really understand these concepts, and so and we need more advocates and more people out there advocating for this in our school system. I know we have so many things going on at this time,
Right.
but in reality, that in itself is one of our biggest barriers, because you don't want young people to make assumptions about sexual health and
Right.
sexuality. You want them to have accurate information.
Mhm.
So when they are doing, and they do become sexually active, they
Mhm.
have the tools necessary to live a healthy life. I always talk about it in that way. I don't talk about it in the way of like saying that you can't be sexual and sexuality is wrong and it's a limitation. No,
Not
this
realistic.
it's
Mhm.
not realistic at all. And yes, and I know I hear sometimes you hear from parents and they're like, oh, I don't want, my kid to know this and know that. And like I've actually sat in some PTA meetings where I heard parents said that kids reading a question was actually going to encourage them to engage in that behavior. And my response to that was, they probably are already engaging that behavior, and
Well,
you're fearful of being asked this question. And the whole
right.
point of this, I was working at the New York City Department of Health as a youth risk behavior survey coordinator,
Okay.
and the whole purpose of us doing this survey is so that we can gather information to see what kind of services students actually need, what young
Right.
people actually need, where should our money go to in relation to this issue and
Mhm.
regarding sexual health, and it's or and it wasn't just focused on sexual health. It was all aspects of health for young people. But the idea that the sex part and the drug use part was the part that was scaring them the most. That's
Yeah.
so problematic these days.
Right.
Um, you
And I
know,
guess it's really important that not only do they have the right tools and we have all this stuff set up, but that they have someone or some persons that they trust,
yes,
that will give them the right information. Um,
definitely.
because I mean, sometimes the parents go, "Oh no, I don't want to talk to my kids about sex. Oh no, abstinence." And I look at them and go, "You were 15 at one point, right?
Hmm.
When you were 15, did that work for you? I mean, or did you need more support? Or, what did you have?" But no, I hear
It's
you.
natural.
Yeah, like, come on, let's get realistic. I mean, these kids, they are humans. They have these human bodies, right?
Yes.
That react to things, and sometimes they don't understand what's happening. They need someone they can trust and go to talk to.
Hmm.
Um, so advocacy for more health and sexual education, or education in
That's
general.
one part.
Okay.
Yeah. And that includes, and I say that education part goes all the way up to how we training our providers.
Hmm.
And I guess this is where we come into like the interaction, the interpersonal level of it. And we don't really have any standardization with education, sexual health in any of our health provider schools either, with the curriculums in the medical schools, nursing schools, and they're the ones who are interacting with people daily regarding these sexual health. Like I said, I've heard experience where people were scared to talk to women about PrEP because they felt that they would offend them.
Mhm. Right.
And it is like,
Right.
well, if you
Yeah.
as the provider in your position is being the person who basically has the knowledge and has the tools,
Right.
is fearful of speaking to the patient, how are we going to get beyond that?
Right.
So
Right.
I do think not only do we have to educate our children, but we
Mhm.
also need to educate our providers and all of them, not just especially primary care, because usually people have, especially with women, we depend so much regarding our sexual health or on going to the gynecologist, but we also go to a primary care physician also, or provider. And so they themselves should have the tools necessary to engage these conversations. There's so many missed opportunities with engaging women in sexual health practices, and because we think, well, we're going to put this to the side and this is not a part of their life. Like, why is that what this part of our system and our bodies separated from everything else?
Right,
You
right,
know,
right.
if you're screening me for diabetes and cholesterol, screen me for STI and
Yeah,
HIV. Like,
yeah.
that is fun. That's my whole body right there. So
Right. I
I
mean,
think,
that if you're going to talk about the whole person, that's the place.
yeah,
So why not do it? Um,
exactly.
yeah, no, I remember when I was in an HIV/AIDS care center within a very large healthcare organization out in Manhattan. Um, we had the providers, the PCPs, and we had a gamut of providers there for what is it, like meditation and nutrition, all kinds of different things, down to pharmacy, down to social work, down to primary care. And we also had a peer program. So
Mhm,
we had peers that were HIV positive who have been there, done that, and could best advise. So like having someone who's like you, who
mhm,
represents the other side also helps. So like peers, having a peer program or peer approach also I find works. When the providers are not comfortable talking to folks about certain things, the peer will come in and go, well, hey, I'm you. So, and I also represent the doctor, but I'm you. So it's a
mhm,
more comfortable situation. Like with, I can imagine the children. I also embarked on creating a not-for-profit organization, especially for minority adolescent females. And I wanted to have a holistic mentoring approach on finances, health, nutrition, the gamut, career, everything. And I wanted to have a mentor who was also like a peer and someone that can meet the female participant face to face
mhm.
and meet that person where she is so that she's not feeling intimidated or overwhelmed or whatever, just to help break down the barrier to get to the real issue and move for improvement. But so now I hear you. I mean, it's like you have to address all of the issues at the right time, right place.
Mhm,
So you kind of answered my next question already. Like, what's the key issue? So we talk about the health, education, the
mhm.
education. Is there anything else? Like, because I would love for folks as they're listening to this to get motivated and want to reach out to their contacts and say, hey, I listened to this nice talk and Dr. Bond was talking about this and that, and we really let's do this. Let's talk about this in our shop and start the conversation. So what other key issues do you think are we need to pay attention
Well, one of the things I didn't address really, but directly, but I always want to bring attention to, is that most of the stigma, especially among Black women, when it comes to sexual health, is related to racism and sexism, and we call that like gendered racism that they experience in everyday society, right?
to? Right.
And so we can't address this issue unless we address the racism that they are experiencing.
Interesting.
And it will be very premature for us to ignore it and
Hmm.
to act as if it doesn't exist and act as if their lives are not impacted in this way.
Right.
So I think that in itself is the main overarching issue. And so we need to come up with strategies and ways for us to do that in order, because it's not as if women don't want to get care or they don't want to access services, but
Right.
if they are discriminated against or someone is put has this very judgmental approach with them in the clinical setting,
Right.
what do you really expect to happen? you know
Yeah.
so we really need to address that. If we see it happening where when it comes to maternal health, reproductive health, we see it happening. I just saw a young woman post about her bad experience within the healthcare system, and young Black women. So in itself is problematic, and I can even talk about my own experience. as a young Black woman, and how I felt unheard with my provider. And I had
Wow.
at that time, I did something very radical, which is not normal, where I said, you know what, I don't like you, and I'm gonna go find somebody else that I'm comfortable with. And in all honesty, after that, I've always had, just full disclosure, always had a Black female gynecologist because of that, because that was the first time I felt heard in a clinical setting. And so that in itself speaks volumes about what is really needed in the system, like what kind of practices
Right.
we need to create in their clinical settings, what kind of policies we need to enact, like making sure that, yes, these questions are asked to people in this
Right.
way, and this is a standard practice. We are asking to engage women. Do they want testing, regardless of their race, their marital status, their sexual orientation? They have the right to access these services.
Oh, yeah.
And I think it's so important for us now to get away from that, a one size fit all. And I'm just going to assume, if you see me wearing a wedding band, don't assume that I don't need a HIV
Right.
test,
Right.
you know,
Right.
and don't make it seem
Um,
as if only certain types of people need these tests.
yes, I mean, and the statistics that you were showing during the presentation is very reminding me of what I saw when I was back at the HIV/AIDS clinic, that the population that was showing up with the new infections, the largest were the Black females. And it had to do with their partners that they thought were monogamous, who were living the down low lifestyle, or whatever you want to call it, or just unfaithful. And then there was the issue of domestic violence. So I
Yes.
wanted to bring that up, but like you said, how much time do we have?
Yes.
I could talk to you for hours. Yeah, I mean, so no, thank you for that. So we have the education, and then addressing the racism. It's a lot of different systemic issues, I
Yes.
guess, that we'd have to tackle one at a time. And I would really love to, I'm talking to the listeners of the show right now. You know, really with this show, I guess, Dr. Bond, I'm gonna maybe make this like the stepping stone and have you back on with some other folks. And I mean, this podcast is about how do we use small data. So as you're talking, I'm thinking in my head, ooh, I want to really dive into the numbers and really gather some statistics that show the stories that go,
Mm-hmm.
something's not quite right here. And we need to focus. Okay, let's put together a task force and get on that. So there are a lot of organizations doing just that, and National Minority Health Association is one of them. A couple of others that I will be talking to soon. So I really appreciate the things you're bringing to the table. It's really, it's energizing me, and I'm hoping that it's energizing the folks that are listening. So and then my last question, I think you already answered a lot of this. What is really needed for us to improve the situation? Let's just focus in on the health education and the racism piece. Where would we really start with that, in your opinion? Or let's just take education for one.
I think, oh yeah, with education, I think one, it needs to be medically accurate, and then with the sexual health education, we need to focus on it being positive, being respectful, and being non-judgmental,
Right,
and that's what makes it inclusive. Um,
right, right.
and I say, and not making assumptions about people's practices or their identities,
Right,
in that respect, and and talk about pleasure. So many times when we talk about sexual health, we forget that people enjoy sex. We
yeah.
forget that,
It's like,
you
ooh,
know,
that's
we always talk
taboo.
about the bad
Yeah.
things. We always talk about like what's
Right, right,
bad
right,
about sex. Like we're still in that fear-based mentality.
right,
And we need to really get out of that, because that's the only way we are going to open up the conversation
right,
and change the dialogue and the narrative of how we approach sexual health. If we
right,
constantly focus on everything that can go wrong, we can never talk about what goes right. And we
right,
can never talk about it in a way that is more than the absence of disease,
right,
because again, it's not just about the physical part, it's about the emotional and the mental. So I always talk to people when I talk about what you need
Mhm.
for a healthy sex life, and I say it's a CCP, and I was like, that's consent, communication, and pleasure. And if you get those three down, you're good to go.
Yeah, write that down. Yeah.
um,
Well,
be-
okay. And then
yeah.
one more you were saying with the racism, where do you think we need to start or, to improve on that? Like just one or two comments on where do you think we need to start tackling that one or get better with that one?
Well, I think one easy way, um, there's so many different ways that we could address it, but
Mhm.
if we want to start at the interpersonal level,
Yeah.
start in the schools, start in with the schools for the providers, the nursing schools, the medical schools, the physician assistant schools. Like this should be a framework, social justice, looking at
Right.
anti-racism is part of being in their curriculum should be a priority for many of these places because they are dealing with vast with different people in our
Right.
society. And they need to have an understanding. It's not just about cultural competency, it's about cultural humility and understanding the people that they are serving. And so that's I feel like the simplest way to address racism. We know this is an
Okay.
institutional problem. We know how far this goes. But if you start to change the narrative, if you get to them before they are outside engaging with
Early on.
the,
Yeah.
um, the community, then we can make some changes. And
Yeah.
then at the policy level, we enact these policies that protect people, protect their health,
Mhm.
give them the services they need,
Mhm.
because to reach health equity, we can't assume that everyone's receiving the same treatment. And I think that that's the thing, like people don't really understand the difference between equity and equality. They
Yeah.
think equality really is everyone getting the same thing. And we're
Mhm.
not there. We are not there at the level where people can actually receive the same treatment and still have good health outcomes. We
Right.
need to take an equity approach to this. We need to really tailor it to people's needs. And like you were saying, you're talking about like domestic violence.
Mhm.
So you know what? There's this great organization in LA called the LA Women's Center. And
Okay.
one way that they have approached engaging women about PrEP usage
Mhm.
is to reach them at the defense classes, the self-defense classes. Many
Wow.
of the women who go there to receive assistance regarding, domestic violence
Mhm.
issues, they go attend these classes. And so they use that opportunity to engage them in PrEP, educate them about PrEP, and not
Right.
only that, assist them in navigating them, in the system when it comes to PrEP.
You
And
know what?
I think, and
It's
these
about protecting yourself. Both of it.
yeah, it's
Yeah.
more to our lives are not that simple,
Mhm.
really,
Yeah.
and it's important for us to continue to think about it in that way. So instead of us saying, well, we have all these, like, well, the clinic has this and the hospital has this, and
Mhm.
that, doctors have this.
Mhm.
Reach the people. Where are they at? What's going on? How can we engage them? How can we find out what they need and what they're experiencing?
Right. Right.
Use that data in a good way, as you
Mhm.
said. Stop just
Totally.
saying that it's bad. Like I feel like I've been living, I've been in public health uh, since I was 20 years now. But I'm
Right.
counting the time I was in college because I was interning.
Okay.
um,
Okay.
but the thing is, for so long, we just had this negative view about sexual health. And we
Mhm.
never hear what's good about us, what's good about our community,
Mhm.
how we could build upon what we know. We always have this deficit model of
Mhm.
approaching it, and we need to look at the assets we have and
Right.
build upon that, so it'll start to minimize some of those challenges that we're experiencing, you know?
You know what? It's like also, I think the fact that we are where we are, the cultural thing
Hmm.
has something to do with that. I mean, like I can just hear my grandmother in my head saying these comments, and the woman that used to take care of me when I was little, I could just hear these ridiculous, I mean, so it's a cultural thing too, but we need to get to a place, I mean, as Black women and girls, get to a
Hmm.
place where sex is normal and it's normal for you to want it. I mean, and it's normal for you to want to learn more about it. And, it's okay to talk about it.
Hmm.
And just as you were saying, like to me, people, when you were telling me about your story, how you chose another GYN that you felt more comfortable with, it reminds me of a book I read called Mind Over Medicine by
Mm-hmm.
Dr. Lisa Rankin. And she was basically talking about the white coat versus the patient. Now, the patient is the one who's in charge,
Mm-hmm.
and the patient has a healing roundtable. And if
Mm-hmm.
the patient is the one that invites the doctors and the providers and the friends and whomever to the table as part of his or her, you know, healthcare. And that patient can play an active role in his own or her own healthcare by inviting people to the table. And if you're not comfortable with a certain doctor,
Mm-hmm.
send them away and invite someone else. So I always remember that book, and I love when you said you decided to go with another provider. I was like, yep. I mean, because it's on you. I mean, you have the power to choose who's in your circle, who's at your
Definitely.
table, and you're
Yeah.
in charge, not the doctor.
And it's,
So
yeah, at the same time, it's important for us to realize, I was in a very good position to be able to do that. Like, even though I was still young and I'm still under
mm,
my mother health insurance, I had a parent who encouraged me to
right,
go to the doctor and go get, screenings and things of that
right,
nature. So we had a very good open relationship about those topics. And
right,
so I didn't have a fear of, if my mom, saw me going to the gynecologist, she was going to crucify me, or
right,
in a way, because I was actually taking care of my body.
right.
And not everyone is experiencing that. And I
Yeah,
always, and I have to acknowledge that privilege of having a parent who was supportive of me being sexually healthy. Um,
very true, very
so,
true.
and having the access to private health insurance.
Yeah,
So
this is multifactorial.
it is. It's so many different levels. So, and that's why, I try to encourage people to advocate for themselves, but we also have to acknowledge that there's a lot of barriers to people
Yeah,
accessing
totally.
proper health care.
Whew. Dr. Bond, I could talk to you for hours,
I know.
and I can't wait to continue the conversation, but we are running out. We are just coming to the end of our program today. It's 1:05. So
Oh, wow.
thank you, thank you so much for sitting with me today and having this discussion. I'm really looking forward to having you back on the show. And we can continue talking about, other topics. And I would love to have you sit on a roundtable with a couple of other people that I've met um, in this journey as I'm doing this podcast. And myself, I've been in healthcare for about 20 years. I actually grew up in healthcare, and I have many contacts along the way, and so much stuff is popping up in my head. So I'm so excited to like
Oh,
add you to
great.
some other stuff. But thank you so much for joining us today.
Thank you for
And
having me.
thank you. And thank you to my listeners for joining us today, and joining in this journey on Let's Talk Small Data with T. To subscribe to the podcast, you can find us on Spotify, iHeartRadio, and TuneIn, and look up Let's Talk Small Data with T, no apostrophe. You can also visit Emma, EIMA Inc.com, and click on Let's Talk Small Data to learn more about the podcast. And that brings us to the end of the program. I want to say have a wonderful day. And remember, unleash the power of your small data. It's your most powerful and strategic asset. See you next time. This episode is brought to you by Effective Information Management Systems, specializing in healthcare small data and offering expertise that goes beyond technology. Visit www.eima-inc.com to learn more about Emma and the podcast